Hi, good evening. My name is Dr. Sara Kaplan, and I am a member of a CureLife Advisory Board. This evening, I would like to talk about a diabetic healthy diet. It is well known that the prevalence of diabetes mellitus is increasing around the world at a rate that appears dramatic as to have been characterized as an epidemic. Diabetes, being a metabolic endocrine disorder, is directly connected to carbohydrate, lipid, and protein metabolism. The resultant disease or metabolic disturbance leads to hypoglycemia and dyslipidemia in the short term, as well as long-term complications such as retinopathy, nephropathy, and neuropathy. Besides, persons with diabetes are 2 to 4 times more likely to develop coronary artery disease or to suffer a stroke. Diet and physical activity are critically important in the management of the hemoglobin A1C, blood pressure, and cholesterol level of type 2 diabetes. Maintenance of near normal blood glucose level dramatically reduces the chronic complications associated with this disorder. In addition, reducing elevated blood lipid levels has been shown to lower the incidence of acute coronary events in other at-risk populations. I believe that diabetes cannot be completely cured, but it may be more easily regulated and controlled with the right diet and use of dietary supplements such as Curelin by CureLife. With strict nutritionist advice, understanding how to balance food intake, and making healthy food choices every day, diabetic patients may be able to significantly improve their quality of life. Why is diet important? A person with diabetes may affect the disease by controlling how much and what they eat, how frequently their blood sugar is monitored, physical activity levels, and the accuracy and consistency of medication dosing. Even small changes can affect blood sugar control. The diet should be a balanced diet that is tailored to a person's medical needs, lifestyle, and personal preferences. Eating a diet with consistent amount of food every day and taking medications as directed can greatly improve blood sugar control and decrease the risk of diabetes-related complications. For many of my diabetic patients, the most challenging part of the treatment plan is determining what to eat and following a food plan. As I mentioned before, there is not one-size-fits-all eating pattern for diabetics, and each patient should receive individualized medical nutrition therapy. Emphasis should be on healthful eating patterns containing nutrient-dense, high-quality food with less focus on specific nutrients. The Mediterranean, the dietary approach to stop hypertension, and plant-based diets are all examples of healthful eating patterns. Let's talk about the goals of nutrition therapy for adults with diabetes. The first one is to promote and support healthful eating patterns, emphasizing a variety of nutrient-dense foods in appropriate portion size in order to improve overall health and specifically to achieve and maintain body weight goals, attain individualized glycemic, blood pressure, and lipid goals such as cholesterol and triglycerides, and delay or prevent the complications of diabetes. The second goal is to address individual nutrition needs based on a person's medical needs, lifestyle, and personal cultural preferences, willingness, and ability to make behavioral changes. The third one is to maintain the pleasure of eating. And finally, to provide an individual with diabetes the practical tools for developing healthy eating patterns. So, what should I eat? There is no one single optimal diet or meal plan for people with diabetes. The proportion of carbohydrates, fat, and protein should be individualized based upon the metabolic status of the individual weight loss needs, lipid levels and renal functions, blood pressure, and food preferences. While protein and fat do not affect blood glucose levels significantly, they do contribute to the number of calories consumed. Eating a consistent number of calories every day can help to maintain body weight. Considering the need for weight loss, body weight management is important for overweight and obese people with type 1 and type 2 diabetes. Many people with type 2 diabetes are overweight, as weight gain is a potential side effect of some oral medications used by people with type 2 diabetes. Therefore, lifestyle intervention program for the above should be intensive and have frequent follow-up to achieve significant reduction in excess body weight and improve clinical indicators. Losing even a small amount of weight, 5 to 10% of total body weight, can improve one's parameter in diabetes. In fact, eating fewer calories can reduce blood sugar levels even before the first kilogram is lost. A diabetic patient has to reduce body weight by eating fewer calories and exercising regularly, as can be seen in Cure Life blog. Also, increased physical activity can lead to improved glycemia, decreasing insulin resistance, and reduced cardiovascular risk factors. What about carbohydrate consumption? The fraction of total calories to be obtained from carbohydrates is generally in the range of 20 to 45%. The diet should be low in sugar and refined carbohydrates, while relatively high in dietary fiber, especially soluble fiber. A diet that is high in fiber, 25 to 30 grams per day, may help control blood glucose levels and glycated hemoglobin. Likewise, people with diabetes may be encouraged to reduce their intake of carbohydrates that have a high glycemic index. In conclusion, the diet should include carbohydrates from fruits, vegetables, all grains, legumes, and of course, low-fat dairy, lean meats, nuts, and seeds. Let's talk about fat consumption. Fat quality is more important than fat quantity. Saturated fat and trans fat are found in solid fats like cheese, red meat, and margarine, contribute to coronary heart disease, while monounsaturated and polyunsaturated fats like in fish, olive oil, and nuts are relatively protective. Saturated fats can be replaced with monounsaturated and polyunsaturated fatty acids. Trans fatty acids consumption should be kept as low as possible. People with diabetes are at increased risk for heart disease and stroke, and eating a diet low in saturated and trans fats and cholesterol can help reduce cholesterol levels and decrease this risk. In addition, eating food rich in long-chain omega-3 fatty acids such as fatty fish, nuts, and seeds is recommended to prevent or to treat cardiovascular disease. However, evidence does not support beneficial role for omega-3 dietary supplements. Regarding protein, the usual intake of dietary protein should be approximately 10 to 25% of total calorie intake. Patients should be encouraged to substitute lean meat, fish, eggs, beans, peas, soy products, and nuts and seeds for red meat. In individuals with type 2 diabetes, ingested protein appears to increase insulin response without increasing plasma glucose concentrations. Therefore, carbohydrate sources high in protein should not be used to treat or prevent hypoglycemia. As for sodium, Just like the general population, people with diabetes should limit sodium consumption to 2300 milligrams per day, although further restriction may be indicated for those with both diabetes and hypertension. For people with diabetes and heart failure, further reduction in sodium may be necessary to reduce symptoms. As for alcohol, adults with diabetes who drink alcohol should do so in moderation, no more than 1 drink per day for adult women, and no more than 2 drinks per day for adult men. In addition, exercise. Increased physical activity can lead to improved glycemia, decreased insulin resistance, and reduced cardiovascular risk factors. Exercising regularly can help lose weight and keep it off. The recommended amount of exercise is 30 minutes per day, most days of the week. Last but not least, meal timing. Consistently eating at the same time every day is important. Good eating habits can help to control the disease and may be able to improve the quality of life. And before ending our lecture, I received many questions from you, and thank you for that. And I have chosen a few that I think are relevant to everyone to answer. So I start with Jeff Smart, who asked, most diabetic diets are meant to reduce your blood sugar. How do I make sure that my blood sugar levels do not go too low? Well, dear Jeff, the purpose of a balanced diet, which is tailored for you, is to reduce your blood sugar and maintain of near normal blood glucose level. You should test your glucose level daily if you can, or at least once a week. Phil Williams asked, what foods are safe to eat, if any, because of the fructose? Well, dear Phil, you can have all kinds of foods. However, you should pay attention to the quantities consumed in accordance to your overall diet, which I hope was prescribed by your dietitian. Scott Edgar just found out blood sugar levels are high and wondering about a good diet to start with. Well, dear Scott, first I hope that after my talk you feel more informed, at least as of the basics of a balanced diet. My best advice to you is to go to a registered dietitian and get a tailor-made plan specifically for you. The last one for now. Tara Dolan. What can I eat for balanced diet in regards to type 2 diabetes? Well, dear Tara, I love your question because the answer lies in the body of it. A balanced diet done right for your specific needs should include all kinds of foods and should help to keep glucose levels in check. I would suggest using supplements such as Qulin that can go a long way in managing glucose levels together with a balanced nutrition plan. Well, thank you and good night, everyone. I hope you enjoyed the lecture, and I'm looking forward for the next one. Bye.